Good evening and welcome to our webinar this evening presented by Dr. Marianne Dorn. We'll be talking about disc extrusion, canine disc extrusion and the road to recovery. If I could again ask, if you are joining as a guest this evening, please stay muted. We are recording the webinar and we will send links so that you've got access to it after the presentation. I'll upload it with a private link and share that with you. My name's Ian Seath. I'm Secretary of Dachshund Health UK. We're a canine charity and we've been running a series of webinars with Marianne over the last month or so, and this evening's is specifically focused on physiotherapists. So hopefully you're all in the right webinar and you're very welcome this evening. Marianne qualified in veterinary medicine from Edinburgh University in 1996, and she worked for many years in small animal practice. In 2014, she got a postgraduate certificate in small animal rehabilitation, and that was at the University of Nottingham. Since then, you may have come across her. She's worked as the rehab vet, and she'll be no doubt sharing her links for her website with you in the course of the webinar this evening. So Marianne spends a lot of time helping patients with orthopedic or neurological problems, and she has a special interest in finding practical solutions for dogs with intervertebral disc disease. As I said, we will be taking questions at the end of the presentation. If you'd like to drop questions into the chat box, we will make sure we try and pick up as many of those as possible. And if again, I could just remind you, please stay on mute through the webinar this evening. Marianne, let me hand over to you and over to you for your presentation.
Thank you very much, Ian. That's great. Lovely to be here this evening. Yes, so canine disc extrusion for physiotherapists, and we're going to focus mainly today on outpatient sessions for these dogs. Because of the time limits, we can't cover everything. So I'm going to really focus on therapeutic techniques, and I'm not going to say too much about assessing these dogs today. But first, let's just have a quick recap on what is a disc extrusion. Certain breeds are predisposed to a disc extrusion, French Bulldog and the Dachshund being two of these. And in these breeds are chondrodystrophic. So in these breeds, their intervertebral discs degenerate early in life. So here we have a schematic diagram of 3 vertebrae with intervertebral discs here shown in blue sandwiched between them. If we just go on to the next slide. So what happens with these dogs is if the discs degenerate, so they are then prone to the fibers of the outer annulus fibrosus eventually rupturing, and that can then lead to the center of the disc, the nucleus pulposus, squeezing or exploding through the gap and impinging on the spinal cord in that location. Here's a diagram of a cross-section of the disc with the nucleus pulposus squeezing through, and this can cause pain, and it can also cause damage to the spinal cord, which may be mild or moderate or severe and permanent. And it can also leave the dog with compression of the spinal cord due to the disc material and debris that's left in this location. And interestingly, actually, we know through some recent work done at Cambridge University that these dogs, some of them will recover functionally, even if that compression remains. So that's interesting. Not all of the dogs will recover. And for some of them, the damage to the spinal cord is too great for them to actually recover function. And a quick look at their clinical signs. Most of these dogs are painful when they first present. They may be hunched in appearance, like this Cocker Spaniel here. They might knuckle their paws upside down, which of course is always abnormal in a dog. We've got videos here of dogs with thoracolumbar disc disease. Here we have a dog that can walk who is paraparetic, So he has weak hind limbs. They will occasionally cross over. They're placed abnormally. They sometimes buckle and overflex as weight is put through them. And they may also just drag along. The toes might drag along slightly or knuckle slightly. And here we have a non-ambulatory dog who has completely paralyzed hindquarters, and she is just dragging her rear end behind her. Okay, so let's think about getting started with our physiotherapy. Now, this is a challenge. Many vets are actually quite wary of referring dogs for physiotherapy if they have a disc extrusion, because there's a feeling that if these dogs do too much, they might have a relapse due to the overactivity. However, physiotherapy is really useful for these dogs. And here's why. So we can help these dogs move with better, safer support. We can help them achieve balanced, natural postures, initially with support. And we can support the owners in helping these dogs restrict their day-to-day activities safely. And we can remind the owners to rest their dogs appropriately. And we can get going and teach owners gentle handling techniques, which can improve the confidence and comfort and confidence of these dogs during recovery. Just a quick mention of this book. So we now have this book available, which is a great resource. It's aimed primarily at dog owners with very clear text, simple text, lots and lots of pictures. It's a really practical handbook, and it covers just about everything that owners might want to refer to at home during their dog's recovery. So it's a great supplement for them to use in addition to talking to their vet or physiotherapist. And some physiotherapists are also finding this useful in the clinic to refer to, but also to show pictures to owners as a sort of way to help remember what they're supposed to be doing at home, as a way to illustrate what you're saying. So this book is now available through Amazon with next day delivery. And before you get started with these dogs, it's a good idea to think about what is that dog's routine like at home, or what is it supposed to be like, so that you can fit your physiotherapy and what you prescribe in with what they're doing at home. And that way they won't end up doing too much, or you won't end up asking the owner to try and do too much if they're already overloaded with tasks at home. So these 6 pictures correspond to 6 kind of overall routines that these dogs might be following. The names of these routines are from the IVDD handbook. And just to give you an idea, so we've got movers and improvers, and these dogs are they're able to walk. They've just had surgery, or they've just had an injury without surgery, a disc extrusion without surgery. They're able to walk, but they need to be confined in a pen or crate for their safety. Number 2, learner dogs. They've also just had their injury or surgery, but these dogs cannot walk, so they need to be supported with a sling. Leaky learners, just the same as learner dogs. So they've recently had surgery or injury, they cannot walk, but they're also incontinent. And this gives the owner a lot of hard work in many cases. So they may need extra cleaning. They may also need their bladder to be expressed regularly. It can be really hard work to care for these dogs at home. So these 3 dogs in the top here, their routine at home involves being almost all the time. They will be in a crate or a pen. I've got at the bottom here a picture of an open top pen of an appropriate size for early recovery, usually up until around 3 weeks, at which point it could be extended in most cases into a larger pen. Of course, if the dog's likely to escape, they should be in a closed top crate for their own safety. And whenever the dog is outside this pen, they need to be carried or on a lead. They are not allowed to just wander free. So that's the case for these 3 routines at the top. And then we've got graduates, what I call graduates. They're the dogs that they're just coming to the end of their crate rest or pen rest period, and they're starting to be allowed to wander. And then wheelers, as the name says, these are dogs that have not learned to walk, and they have now been fitted with wheels. And walkers aftercare. So this is a long-term routine for dogs that have actually recovered, but perhaps they're left with a slight gait abnormality or reduced stamina. And so they're sort of back to a near normal, their new normal, which does involve some little changes. So in your physiotherapy sessions, here's a suggested list of what you might include, just an overall guide. Of course, you'll need to assess each dog, and you'll need to take a history as well. But we're not really going into detail about those today. I'm talking more about therapeutic techniques. So top of my list actually is gentle handling techniques, which may come as a surprise to you because this is not really considered to be a therapy at all, but it's incredibly useful to include in your therapeutic sessions. Many of these dogs are overwhelmed. Many of them are actually painful. Many of them have been through a lot. They're finding it, of course, they cannot move as before. So it's a difficult situation for them. And your clinic is a new environment to them. They're meeting new people. So gentle handling techniques are really important. And what these involve, there are all kinds of techniques, and we won't go into them all, but here are a couple of picture examples. So in the top here, I've got a handler just supporting her dog in quite a natural, symmetrical position. She's got him actually sitting there. She's got her hands softly curled around his shoulders, and she's going to respond to if he's leaning forward or tipping right or left. And this is quite a secure hold, but also quite comforting for the dog, really appropriate, particularly for broad-chested breeds such as the French Bulldog. She's also got him fitted with a harness, and it's a good idea to have a few adjustable harnesses in your clinic, so if he does suddenly wriggle, she can always grab onto a harness strap for extra security. That's a good safety tip. And yeah, these harnesses are incredibly useful as they support the dog around their center of gravity. So that's one technique. And just another example, here we have a dog within a hydrotherapy center who's being showered down before or after their hydrotherapy, before going in a treadmill or pool. This therapist is aiming to make this showering experience into a therapeutic experience so that the whole session becomes therapeutic. So they've actually got this dog supported in a fairly natural, symmetrical position here, pretty much standing. The therapist is helping to prop the dog up using her knee and a hand softly curled round with her fingertips over the dog's sternum there, which is another great way to just help balance the dog and is unlikely to cause pain or distress. Again, fitted with a harness here. So there are various handling techniques out there, lots to explore. Also very high on my list is owner advice. Really worthwhile giving information to owners. They're going to be caring for the dog for the rest of the week in between your sessions. So what you say to them is really going to make a difference. For most of these dogs, I include some kind of movement therapy and perhaps posture exercises. the movement therapy might be as simple as just some sling walking or some lead walking. And we'll talk about the posture exercises later this evening. We also often include some kind of touch work, and I've listed here massage, range of movement, sensory touch techniques. However, sometimes these can be overwhelming for dogs. So assess your patient, see what they're going to cope with, and be prepared to do less if necessary. We certainly don't want to be pinning them down for something that they just cannot cope with. And I've put electrotherapy here with a question mark. You certainly may include some kind of electrotherapy. You may find yourself that it appears to be useful in your practice. To be honest with you, there isn't any good evidence behind any of the electrotherapies as yet. So just be aware of that and think about prioritizing. So let's look at giving home advice next. Here's a dog being sling walked. And for dogs that cannot walk, that's going to be a big part of their daily routine. So these dogs, they need to be taken outdoors for toileting. Typically 5 times a day is quite standard. And that would be first thing in the morning, last thing at night, at lunchtime, and maybe mid-afternoon and mid-morning. And that's usually for no more than 5 minutes at a time to start with. And of course, these dogs must be supported with a sling. There's an outdated practice of holding these dogs up by the tail, but we can't be holding dogs up by the tail. Of course, dogs' tails are not designed to carry their weight, and they contain sensitive structures, including part of the spine. And holding them up by the tail, supporting their weight by the tail, can cause bruising and discomfort. So certainly do use a sling, and it's worth having some in practice if you see these dogs. Don't assume that the owner will know how to use the sling. Most don't when they start. It's always a bit of a learning curve using a sling. What I recommend they do, and I would say do teach them, to take the time to teach them to use a sling. You're the best person to do this. The vet probably won't have done so. Their sessions are particularly short. So using the lead and sling, what I recommend they do is hold the lead in one hand and the sling in the other hand. And the reason for doing that is that the lead and sling do separate things. So the sling just provides enough uplift to support the dog's rear end so they don't fall, while the lead mainly acts as brakes backwards to stop the dog hurrying forward. Got an example here of a dog being sling walked. So they're going very slowly, stopping there. It's nice to see the owner stopping when the dog stops. He's dragging his paws a bit there. And when he comes here, he chooses to shake off, which is fine. Nice to see him actually doing a good stand after shaking. He's kept his balance. The owner has even managed to reduce the support on the sling for a moment after that. And when he does get going, you'll see as he crosses the path, you'll see he's actually walking perhaps a little bit better. Those paws are just about going the right way up. And he did go on to make a very good recovery, this dog. So key tips for your owner, for your client, are go slowly, stop when your dog stops, and yes, hold the lead and the sling in separate hands. Walk on the dog's weakest side. That's a useful one. So when you assess these dogs, decide which is the weakest hind leg. That'll be the one that tends to knuckle most. It'll be the one that tends to drag the most. It'll be the leg that tends to give way the most as well when they're standing. And ask the owner to walk mainly on that side of the dog in the coming week. If the dog's symmetrical, then ask the owner to switch sides regularly. And let's talk here about signs of tiring, because when these dogs are up on their feet, even with sling support, they can tire particularly quickly, neurological patients. So signs of tiring, one rather surprising one is simply the dog becoming less cooperative. So they seem to be being naughty. They're doing the opposite of whatever you expect. And if that's happening, if that's sort of happening maybe after a couple of minutes or after 5 minutes or so, that could well be the dog's just simply getting tired. Give them a rest. If their muscles are fasciculating, particularly key muscles in their hindquarters, they are probably tired. And you may also see that they are leaning more onto their strong legs, maybe more onto their front limbs. They may be knuckling their weak paws more often than before. You may see their limbs are sort of giving way or buckling slightly as they step on them more than before. Or conversely, you may find that actually the tone in those legs increases dramatically and they just really cramp up and become rather spastic because of the upper motor neuron tone. So these patients fatigue quickly. If in any doubt, rest them. Now, there is an exercise you can prescribe, a lead exercise, even for dogs that are being sling walked. And for owners, I call this 3-2-1 stop, but perhaps you might like to think of it as a transition between walk and stand. So they're going walk, stand, walk. I ask owners to stop their dog very gradually from the lead and think about counting 3, 2, 1, stop. So they take 3 seconds or so to stop the dog. That way, it's going to be a gradual sort of pull from the lead rather than a sudden jerk, and that allows the dog just to shift their weight. What we're aiming for, the reason we do this, for dogs that can step a little bit but not support their weight yet, that stopping and starting is going to improve the stance phase of the step cycle. And for dogs that are paralysed, that stopping and starting is at least going to put the dog's paws in a position set up ready to push off from the ground if they start to be able to do this. So I'm going to play you, it's a very short video. This is actually a completely paralysed dog. He has no deep pain in his hind limbs, and he just drags his limbs behind him. And you'll see in this video, he starts stopping, does a little bit of walking, stops, walks, and stops. So he stopped here. He's going to walk along. I think he's chosen to stop and sniff there. You can see he's dragging his hind limbs completely. The owner's brought him to a stop here. She's just corrected his paw position by gently nudging with her toe. He's allowed to move here. He's completely dragged, and then he's been stopped again. We've got the dog going towards his other owner, whose shoe is down here, actually with the camera. And that's a good tip, actually, is try and get your patients motivated. So it might be the patient walks towards one of their owners, or the patient moves towards food. That really does help them learn to walk. So this dog, completely paralysed, legs dragging, it really felt like just holding a puppet up. An update on him, unfortunately, he still has absent deep pain sensation. But quite soon after that video was taken, he started stepping with those hind legs regularly while sling walking. And now he's actually standing for around half a minute at a time, unsupported. So in the IVDD handbook, there's a whole chunk of the book about home exercises, and that chunk has got this green-edged border. And the exercise I just showed you, that 3-2-1 stop, is here, exercise 1 in this starter lead exercises. And there's another exercise you can do for dogs that are being sling walked, and I call that mats track, which in its simplest sense, it's just putting down a line of non-slip mats and having the dog walk along those. I talk to owners about walking mindfully. They're thinking about maybe trying to walk the dog at constant speed, not rushing too fast. Now, in your clinic, you can also set this up, and perhaps you could set it up as a proprioceptive mats track with different textured mats. And you could even mix and match this. You could put coloured markers down and maybe stop the dog next to the coloured markers, for example. So you could be combining the walk, stand, walk transitions with your mats track. Those different textured surfaces, as the dog moves over those, that is a nice proprioceptive exercise. Another great thing to talk to owners about during your first session is lifting and carrying. They will probably have to do quite a lot of lifting and carrying at home for these dogs. Certainly the small breeds need to be lifted over any doorsteps to get into the garden. And many owners are a bit embarrassed to ask how to carry their dog in this situation, but it's a common issue that people really want to do this right and they're not sure how to. There are so many ways to lift a dog. It really depends on what's comfortable for the owner and the dog. But the key thing is to give some support at both ends so that you're not left with one part of the dog sagging, and also to get that dog close into your chest, so that, well, that's going to reduce overloading on your back and help to stabilize them as well as you're carrying them. So just remind you, give owners clear advice. For most of the week, the dog will be in their care. So hopefully, eventually, your patient will start to learn to walk without a sling. In the IVDD handbook, there's a section on, there's a chapter on how to help your dog learn to walk without a sling, which I approach as really a set of exercises of reducing the support from their sling and eventually making the first attempt at walking without the sling be just a very short distance, just 6 foot or a couple of meters, with some control from the lead. And when they start walking without a sling, it's really helpful to use a specific lead technique. What I recommend you do, make sure the dog's wearing a harness, and it's best to have one with a Y-shaped front, as that's going to put the pressure on their sternum. That's a great point of control for these dogs. Have 2 hands on the lead. So you're holding the handle end in one hand and have the hand nearest the dog. I recommend you have your thumb going towards the dog down the top of the lead like this. Keep the lead pointing back from its clip. That's this part of the lead. And in conjunction with that, really it goes along with that you should stay either behind the dog and to one side or just level with their tail. So just take care not to get in front of the dog. So this is all the stuff that I tell owners. And then you as a therapist can really be even more subtle than that. And what you may start to notice is that as the dog starts to walk, they often really lurch forward and then hesitate and lurch forward and hesitate. And what they tend to do is to overload their forequarters because of weakness in their hindquarters. And you can use a give-take action on the lead, really with thumb or fingertip control, as you feel the dog lurching forward, and this can really improve their gait. And you can get involved with prescribing the dog's lead walking, which is such an important part of their exercise regime. Now, obviously, check their notes. You need to work within what their vet or surgeon has already prescribed. That's usually a maximum of 5 minutes at a time to start with. And I'll be honest with you, in some cases, you're going to find you'll need to actually reduce that further. So you may find, if you actually watch these dogs in the clinic, you may find they tire well before the 5 minutes is up. Remember those signs of tiring we talked about just before. So it's quite common to find that really what we need to be doing is maybe walking for 2 minutes, carrying the dog for a couple of minutes, and then put them on the ground and let them walk for 2 minutes more, something like that. So assess them in the clinic and advise the dog's owner. Also talk to them about how fast to go. They should be starting off walking, and as you see the dog back at revisits, reassess them. They'll come to a stage at which their walk is quite good and you can start to let them trot. And when you do that, I recommend you just have them trot for no more than 5 seconds to start with. So think about it as being a walk, trot, walk transition, with the owner counting up to 5 during the trot. And when we've already talked about this, walk on their weakest side, we've already talked about that for dogs that are sling walked. It also applies to those that are walked without the sling. So really important, assess which side, which hind limb of the dog is the weaker one, and ask the owner to walk mainly on that side. That's really going to improve their gait. Now, to start with, less is more. So it's much better to do 1 minute of really good walking than to do, say, 7, 8, 9 minutes of walking, sort of hurrying along, overloading the forequarters and dragging their hind paws. So let's think about techniques for gait improvement. We've already talked about some of them. We've already mentioned these walk, stand, walk transitions. They're really useful, whether or not the dog's using a sling. We've already talked about the textured mats track, and it could also be that you use textured ground outdoors, whether that's an outdoor area that you have associated with your clinic, or whether you're prescribing that for owners. So you could talk about using grass. Concrete is fine if the dog's putting their paws down the right way up, otherwise you'll need to steer clear of it. Could be sand, leaf litter, whatever's available. You could introduce, as the dog starts to become able to walk better, so gradually, and this is actually for dogs that are walking without a sling. So you can then gradually start to introduce low-level changes, starting with a lowered curb and building up to a normal height pavement curb. Now, in the clinic, it could be perhaps that you set up some of your own equipment. Perhaps it could be you have a non-slip mats track, and maybe you could raise up one of those mats using a pad or a board underneath, which is just, say, 1 inch and then 2 inches thick. So there's a little level change there. And you could also add in gentle inclines, both up and down, on the lead with your lovely lead technique. That's going to be really therapeutic. And you could ask owners to start thinking about that in their outdoor time as well, once the dog is ready. I'll talk about this in a moment. The walk, trot, walk transitions we've already mentioned, and you can ask owners, you could really test this out in the clinic, see what's possible, and then you could ask owners to do that with care and actually count the steps of trot. Now, varying lead tension when the dog is standing, that can be useful, and I'll play you a video of this in a moment. In fact, let's just play that and I'll talk through it. So here we've got a dog outdoors. So the owner's just making the lead go taut and then letting it go slack again as the dog stands. Very, very gentle. So he's not knocking the dog off balance. She's still able to stand. And believe me, that was for her a very good stand. She had been paralyzed and she was doing really well. You can also see here, this owner is making a point of not getting ahead of his dog. He's certainly not going to let her wander over that cattle grid. And here she's turned round, so he's then turned round, so he's facing in the same way as her, and he's still got that lead pointing backwards. And of course, this isn't in their garden or yard, they've gone somewhere. She's still just getting very short walks at this stage, but what they've done is they've taken her in a dog push chair to where she used to go and walk, where she's happy, and then they just get her out for her prescribed exercise. So you can really get involved with that by prescribing what sort of what to include in those little short walks between physio sessions. Now let's talk about posture exercises, which you could do in the clinic. These include supported or assisted standing, sitting, and also supported sternal recumbency, and moving between these postures as well. And the idea of doing these is that they retrain the natural postures, so valuable to the dog. They improve the weight distribution, so you can help reduce that forequarter overloading, and just try and see if we can gradually get some symmetrical weight bearing, including those hind legs. And you can help improve the dog's dynamic stability as well. Actually, if I just go back to that previous photo, so this is a photo from Cotswold Dog Spa, and here this dog, actually he's able to stand here, but the therapist is just helping him into a balanced assisted stand. So what she's doing here, she's got him on a non-slip mat, and she's just got her hands softly curled around, mainly around his stifles. She's using as a point of control here. And she's very aware of his weight distribution, and she's just, if necessary, encouraging his weight back a touch from both hands symmetrically, so that he doesn't overload his forequarters. And this is an exercise I do sometimes prescribe for home use. If you feel the owner is capable of doing this, and if you're going to teach them anything like this, talk it through with them, demonstrate it, and see how it goes with the dog, because you might need to give them instructions specific to that dog. Demonstrate it, and then give the dog a few moments rest at least, and then have the owner try, and then give the owner some feedback. So don't just simply leave them a written handout, but really teach the process. So here we've got a couple of owners doing this at home. Now, you can see in both cases, the dog is distracted with some food from in front, whether it's food from a bowl, or here we've got food smeared on a licky mat, which is pegged up at dog head height, which is a really fantastic solution if the owner's working on their own. And if the dog is very weak, if the dog is really actually paralysed in their hindquarters, the owner is likely to need to support under the belly, and they may need to give full support, initially at least. And once the dog becomes stronger, they may be able to change their support to having a hand on each side of the hindquarters. And in this case, so this dog had been paralysed, but is now actually able to keep upright. This dog's problem is that she will just sway to the left or right. So the owner's job here is to keep her straight and to keep her central. And so if the dog is tipping one way or the other, the handler is going to bring her back to centre. I should just quickly say, I do ask owners, and of course you'll do this, use something for you to do in the clinic as well, just check the position of the dog's forelegs, and if a paw is way out to the side, too far behind, upside down, or whatever, you need to correct that. But of course, do put your other hand onto the dog's belly as you correct their paw position, so they don't suddenly have that nasty sensation of a paw being whisked out from under them. So you correct their paw position and just get them standing straight. And generally, I would just ask owners to start with the standing for just 10 seconds and then lower the dog gently to the ground, and then build up on this gradually. And they can also reduce their support over the days or weeks as the dog gets stronger. So you can assess the dog and advise on that specifically. And here we've got an assisted sit. And the way I would have, now this is much more tricky actually to achieve. I find owners, only the most talented owners really get this. So it's something for you to do in the clinic, not necessarily to prescribe. If you're doing it yourself and you're confident and gentle, then this is actually appropriate to start even on the first session, soon after injury or surgery. But as just mentioned, I would really postpone prescribing it for owners, or just not prescribe it at all, because it's quite tricky for them. So the way I would approach this, I would start with the assisted stand that we've just seen. It's very helpful with this exercise to have the owner or somebody else in front of the dog with a few tidbits of food, and they should be directly in front of the dog to keep the dog's head in position. When the dog is standing straight and neatly, then you're ready for the sit. So ask the owner to actually say sit and to raise their hand just a fraction, so it's to this position here, into the sort of sitting height of the dog. And at the same time, you can help the dog sit. Now, it's best not to actually press on their rump to get them down into a sit. Avoid that. Instead, let gravity start to take over, so the hindquarters start to sink. And then the first important thing is help that dog stay straight at the back end, because many of them will tend to just go completely skew with their legs shooting off to one side or the other. So keep a hand on each side, so your hand's a guide, so that dog's going to lower down straight. Secondly, see if you can fold those legs into a zigzag like this. In many of these dogs with thoracolumbar disc extrusion, the legs tend to shoot out forwards and straight. So for full marks, see if you can just fold them like this. You may find it's helpful to tuck a middle finger in just cranial to the hock there. Obviously be gentle, see what you can do. This dog actually was quite capable. With those that are actually paralysed, I often use my knees as a backstop. I sort of use my knees just behind the dog's rump at the same time as guiding them with my hands. So you could use your knees to stop the dog from rolling backwards. And once the dog's in this position, you can just help them hold that position. Maybe have the owner eke out another, the owner should give a treat as soon as the dog sits, prompt them to do that. And then maybe they could give another couple of tiny tidbits of food with the dog sitting, because it's so good for the dog to just be in that position. Even with you giving support, they'll need to use their core strength to hold this. And then you could encourage them to get back up into a stand again if they've still got the stamina left to do that. And a good way to help them back up again, when you're ready, ask the owner to say stand or up, and you can try prompting the dog from this position. So this is where you've got the ischial tuberosity, one on each side, or seat bones. I don't know if you can see the cursor here. So just below and to either side underneath the tail. And it's handy to put, it's a good idea to put a hand or fingers, or sort of cupped hand or fingers underneath those seat bones and just nudge upwards as the dog's trying to rise up into stand. And that's a great way to get them up, because they'll still need to push up from their legs. If the dog can't quite manage that, then do just help them up with a hand under their belly if needed. See though if you can keep their paws on the ground, so then you're not actually sort of whisking them off their feet into the air too high. And once they're standing, as soon as they're standing, the person in front, which will probably be the owner in your clinic, should give the dog a little food reward again. So in a moment, I'll play you a video. Actually, this is an owner video. It's actually of the paralysed dog we saw before who was being sling walked. And this, he's going to do some just moving the dog between sit and stand and back again. And you'll see this dog does actually have a little bit of hindquarter tone just starting. The main reason I'm showing you this video is that once he's done that, he has a go at doing something quite subtle, which is putting a little bit of uplift through the dog's chest. Let's play this video and see what happens. It's just, the dog's almost trying to get up on his own here, which would be lovely. So it's just giving just enough support, and definitely some support each side to help keep this dog stay symmetrical. And he's trying to keep the dog's paws on the ground. And we've got a non-slip mat in place here. because they have slick floors at home, and the dog's licking at a licky mat with food in front. Now he's doing this thing of uplift through the chest. The dog's still standing but can't actually keep that position for much longer. So now we're going to do this uplift through the chest in a sitting position. And what this does, it just encourages the dog to lift up through his sternum. And he's actually got to use core strength here to maintain his sitting position. You might have seen right at the end of the video, it just really became too much for this dog, and he sort of shuffled his front paws back. But even just doing this for a few seconds, this is just going to improve his weight distribution. And I don't usually get owners doing this, but this is a really keen owner. But certainly in the clinic, let's just play that again while I'm talking from, say, there. So in the clinic, that uplift through the chest it's a really useful technique. And what you could think about is that chest becoming weightless. I sometimes think about there being a hot air balloon attached to the dog up here. So that chest is becoming weightless. So you're not supporting the weight of the chest like a sack of potatoes. Instead, you're just prompting the dog up. It's an on-off lift through the chest. And in that way, they can start to take more weight with their core muscles and their hindquarters. And sometimes we go on and we, in combination with that uplift through the chest, also start very, very gently and carefully lifting their front paws and replacing them. So that's going to, again, reduce the forequarter overloading and help them take more weight on their hindquarters. In a moment, I'll play you another owner video. There's other techniques you could be doing in the clinic. So this is going to be something I call hind paw sequencing, which is where you support the dog in a standing position, and you help them step on the spot with their left hind leg and step on the spot with their right hind leg. And in this video, they just do it with one leg and then the other leg, and that's it. You can actually repeat this several times, in which case I would call it hind paw sequencing, because it's part way towards retraining a step pattern. However, I don't like to repeat that too much, because if you keep stepping with their hind legs, you're actually going to encourage them to lean on their front legs. So don't overdo it. So you'll see the owner do that just once with each hind leg. And then they go on and they shift the dog's weight back a little bit in a standing position. And you'll see that this is a dog that can actually support her weight in a standing position now. She's no longer paralyzed. And as you can see here, she tends to lean quite heavily on her forequarters. So that's the reason they're shifting her weight back. So let's play the video. Lift one leg. Swap hands, lift the other leg. It's all quite slow. Just make sure she's standing fairly straight. They're shifting her weight back from the harness straps equally on both sides. Be careful with this. Start it with an extremely slight weight shift. You don't want to knock that dog off balance. Make sure she's thinking forward by looking at food in front of her while you shift her weight back. And they're just lowering her to a sit. It's a lovely straight sit, and then she gets rewarded with a bit of food there. And just to point out, these videos are really, really short, and they're less than a minute each. And your therapy, your actual active therapy within your therapy sessions also needs to be in little short bursts, and then just rest and talking to the owner and just gentle handling of the dog. So don't try and fill your whole session packed with exercises. Let's think about touch work and range of movement. So a lot of vets are actually recommending and prescribing massage for owners to do at home. Quite often, though, I find this can just be too overwhelming for dogs. So there are some dogs who really love massage, but not every dog is touch friendly. And we know that many dogs with disc extrusion have reduced pain thresholds. And sometimes just even getting into the traditional position for massage is just too difficult for these dogs. So to start with, look, I've listed here Tellington T-touch, soft tissue mobilization, sensory touch work. These can all be great in the right context. But to start with, I'll just show you a short video of me doing some Tellington T-touch with the dog. So this is a really light touch technique. This is my first time meeting this dog, and actually he found it difficult to maintain sternal recumbency. He wasn't walking. You can see I'm just supporting him with my left hand while I'm just doing very gentle T-touch circles with my other hand. And really, there are lots of different techniques for Tellington T-touch. Many of you probably already do this, but it can be worthwhile going on courses and finding out more. It's a great technique to use. Really key to Tellington T-touch is it's a light touch technique, it's gentle, and you watch the dog as you do it. So watch them for any signs of anxiety or restlessness. Watch them for calming signals, such as licking their lips or yawning. And if you see those, stop what you're doing for a while, pause, take a deep breath, maybe adjust what you're doing, and maybe think of switching to a different technique if they're not getting on with it. If you are going to do sort of more the traditional massage or soft tissue mobilization, and certainly for range of movement, so you'd ideally want the dog lying on in lateral recumbency, something like this. And by the way, this dog's not on a table. This was just Photoshopped with a white background. So I would always try and work at floor level if you can. It's much safer, and dogs generally feel more at ease at floor level as well. I've got a bit of a blanket here as to help support the back, or you could use a rolled towel, or as in this photo, you could position yourself so you've got an outstretched leg to help support their back. And here we've got a photo, come back out of that, sorry. Here we've got a photo of a therapist doing two-handed effleurage, and that could be a lovely technique. So a couple of points with this. You'd always introduce your touch really gently, which could be introducing it with the back of your hand. It could be that you do a bit of Tellington T-touch first, and watch the dog, as I've already said, for calming signals, and adjust what you're doing if needed. And also, it's fine to have somebody at the front end just distracting the dog, maybe giving them a little bit of fuss around their face and talking to them, maybe position the owner there. But don't pin the dog down to have anything done, like massage or range of movement. If they can't cope with it, if they're anxious, if they're fidgeting and wriggly, just abandon that technique and do something else. These dogs can actually recover without these techniques, and pinning them down for something like this to be done is always counterproductive. So here, two-handed effleurage, and it can be really helpful to do long strokes initially wherever the dog is most happy with being touched, which is often sort of around the shoulder area. Then I often do long strokes over their body repeatedly, and then eventually go from the body into their hindquarters. And there are lots of other techniques out there. We don't have time today to go into soft tissue mobilization or massage in great detail. That's just a start. You will probably find in practice, you come across many dogs who just don't want to go in lateral recumbency. So I've got a little very, very short video clip here. It's the same dog as before. And I'm just to show you something that I often do in sternal recumbency. This is called flank stroking. Well, I call this flank stroking. Really, it's effleurage. What I do is I take my hands over the latissimus dorsi and caudodorsally over the thoracolumbar fascia, and I just melt my touch off as I come to the wing of the ilium. And it's a symmetrical thing, symmetrical strokes, both my right and my left hands. And what I'm doing, it's pleasant sensory touch. It's generally not too much out of the dog's comfort zone. And yes, it's got the benefits of a sort of light touch massage. It's also internal recumbency. You're just helping shift their weight back a touch to, again, reduce that forequarter overloading. And I would do up to, say, 7 strokes. I find if you just keep going for much longer than that, it starts to become meaningless to the dog. So let's just play this. We're just fairly slow, thoughtful, symmetrical. And we're watching him, and he's looking fine here. And just at the end, just licked his lips there, which is why I stopped and the video stopped. So that little brief lip lick is a little sign of that dog's not quite sure. He's a little bit anxious, and it may just be he's finding it difficult actually maintaining that position. He really was finding it hard to stay in internal recumbency. So I went from there to just supporting him, and then we actually just gave him a rest and did something else. And you may do passive range of movement. For this, in a perfect world, you'd have the dog in lateral recumbency. You certainly need the limb that you're working with to be properly non-weight bearing, and you need to have the freedom to work with that in one plane, in the sagittal plane, rather than twisting it with the dog sort of flopped in an awkward position. So lateral recumbency, introduce your touch first. That's something I'm not showing in this picture series here. So just stroke gently down that limb so you're not taking the dog by surprise. And then for range of movement, keep your hands quite soft and open. Don't grab onto the dog's leg and pull. I make a point of keeping my thumbs off when I can, because of I was originally trained as, my main training is as a vet, and my physiotherapy teachers always said, you know, I tended to grab with my hands too much, maybe because of that vet training. So I make a point of really keeping my thumbs off, and that's a good point. Really avoid grabbing and pulling with range of movement. Instead, support the weight of the limb with one hand or 2 hands, and then guide it gently through flexion and through extension. So with the front limb, we're aiming to guide the carpus, elbow, glenohumeral joint into flexion, and then also the carpus, elbow, glenohumeral joint into extension. And also I often take at the same time the scapulothoracic joint into a little bit of protraction there, but nothing is forced. So this is just within the dog's comfortable range. And don't, even if the leg is completely flaccid, and some of these neurological cases, the leg may be sort of weirdly floppy, even in that case, don't take the don't take any joint to an extreme of motion. So don't fold the carpus right back on itself, by the way, even if the limb is flaccid. The pelvic limb, so we're here, similar principles. You're supporting the weight of the limb and guiding it flex and extended. Here working with the hock, stifle, and coxofemoral joint. And flexion, extension here, you might notice I'm not actually extending this coxofemoral joint very far. In some dogs, it will go much further than this. I would say this is not unusual. So this Dachshund recovering from thoracolumbar disc extrusion had a lot of resistance to extension there. That's fine. And I just coaxed it. That was my position of my hands, to coax that joint into a little bit of extension, and actually this is much more extension than he had previously, so that's fine. That's the limit I would take it to. Let's look at a couple of electrotherapies. We'll look at laser, as it's probably the most popular electrotherapy for dogs with disc extrusion at the moment. However, applied through the skin, laser light does not reach the level of the spinal cord in dogs, and it's actually absorbed mostly by their skin. how do we know this? So there's been a study on canine cadavers by Piao and others in 2019, and they used a powerful 10-watt light cure laser machine. And they had implanted a sensitive light detecting probe in the spinal canal of these dogs. So they shone the laser through the skin and measured off how much light was detected within the spinal canal. Now we know there's an accepted target level of irradiance that's accepted for studies on this. There needs to be at least 3.2 milliwatts per centimetre squared of light reaching the tissue for it to achieve any kind of therapeutic response. And they measured less than 100th of that within the spinal canal. So that laser light just is not reaching the spinal canal. It's not reaching the level of the spinal cord. That was with the light cure laser machine. There are similar results using other machines in other studies. I contacted K-Laser to find out more. They sent me their data. That was very similar results to this. So what they found, and they were using cadavers and looking at light penetration through the legs. And what they found was that at a depth of at a depth of 7 millimeters, beyond 7 millimeters. What they found was that this target level was only reached reliably in dogs up to a level of 7 millimeters depth, and at a level of 2.7 centimeters depth, this was not reached in any dog. So, and that was using a 12-watt K-laser machine. So that's just not going to get to the spinal cord in any therapeutic amount. Another electrotherapy is pulsed electromagnetic therapy, and this is a biomag machine on the left and a CC loop on the right. Can be quite a practical thing to use on the dog because it really doesn't feel buzzy or unpleasant in any way, and it's quite well tolerated, and it can feel quite convenient just to sort of prop this up against the dog and maybe talk to the owner as you're doing so, or multitask. However, the evidence behind this, it's not very good in dogs. There is a study an experimental study in rats after spinal cord injury, which does appear to show some benefit. So rats treated with a pulse electromagnetic field machine, they did show significantly better functional recovery than those treated with the sham machine. They were treated for 4 hours a day though, that was at 50 Hertz. On standard treatment regimes in dogs, these two very good quality studies didn't show any functional benefit though. So again, these studies in dogs compared the pulse electromagnetic machine with the sham machine. It was all blinded correctly, and yeah, no significant functional benefits seen. So yeah, not great evidence there. Just a few thoughts to finish off. Do always plan your session. Look at the dog's notes and have a think before you start. You need to avoid fatigue with these dogs. So check first, how long can the dog be on their feet? Be prepared to rest them. And during those rest breaks, you could be giving the owner some really good advice. Owner education is essential because they'll be continuing your good work at home. And also consider whether the dog likes close handling. There are always some dogs that just aren't touch friendly at all. And in those, you could do some really useful, for example, sling walking. It could just be a matter of working from a distance, giving owner advice and very little hands-on. And this also can be really useful. I'm sharing this picture here from Canine HS courses because it's a lovely example of planning a session. This is an ambulatory dog, late in recovery, but it's a nice example in any case. What's happening here, this is within a hydrotherapy centre, and the dog is going to go onto this non-slip mat for some therapeutic showering. And this dog is being movement shaped in this direction. So what that means is the dog is being guided using body language and being supported and balanced and steadied using a harness. So we're using body language here to guide the dog in this direction, and also some visual aids here. Some maps and markers have been just put out to mark the way so that the dog is going to go in this curved route round. And in addition to that, the dog's owner has been asked in advance to sit specifically in this location. So this dog is going to actually stand facing her. So he's going to get his confidence up as he's facing her while he has his showering. So this all went very smoothly, and that's a lovely example of planning. It can actually help to set your room up and have some kind of idea of what you're going to do. So just to summarize, do use gentle positive handling. That's essential in every case. Do get owners involved, and do less, but do it better. So sometimes the really good sort of gems of the perfect moments of your session are just maybe 30 seconds long, but that's fantastic, that's fine. And don't feel that regarding do less but do it better, don't feel that the techniques you use need to look impressive or use fancy equipment. Sometimes the most basic techniques are the most valuable, particularly to dogs who they can be overwhelmed by complicated equipment. And finally, fit your advice in with the patient's daily routine. Okay, thank you for listening, and I'm very happy to take questions. Here's my website. It's got a contact page if you need to get in touch. I'll come out of sharing.
Marianne, thank you very much for that. I'm going to stop the recording now, and we'll see if there's any questions that people want to pick up with you. Thank you, Marianne.
Okay.